Bismillahirrahmanirrahim. In this video, paraneoplastic syndromes that involve the skin are discussed with special emphasis on Acanthosis nigricans. Following are the references for this video. The paraneoplastic syndrome that involve the skin are Acanthosis nigricans, Dermatomyositis or Polymyositis, and Sweet syndrome. The main event in the pathogenesis of Acanthosis nigricans is the increased growth factor receptor signaling in the skin. There is activation and or involvement of various receptor tyrosine kinases, and there are many forms of the disease or many causes of the disease that result in many types of the disease. One is the familial form that is associated with germline activating mutation is in the fibroblast growth factor receptor 3 that that is associated with isolated or combined association with achondroplasia or thanatophoric dysplasia. The same genetic mutation is also seen in seborrheic keratosis, but it is not clear that why in some cases it develops seborrheic keratosis and why in other cases it develops acanthosis nigricans. The pathogenetic mechanism of acanthosis nigricans in diabetes mellitus is stimulation of insulin-like growth factor receptor 1, and in cancer, there is increased secretion of transforming growth factor alpha that is that leads to the stimulation of epidermal growth factor receptor. So finally, there is increased growth factor receptor signaling in the skin that lead to proliferation of keratinocytes and fibroblasts. There are five types of acanthosis nigricans. Type 1 is also termed as hereditary benign acanthosis nigricans, and there is no associated endocrine disorder. There is genetic mutation only. In type 2 or benign acanthosis nigricans, it is associated with the endocrine disorders such as insulin resistance type 2, diabetes mellitus, hyperandrogenic states, acromegaly, gigantism, Cushing disease, hypogonadal syndrome, and insulin resistance, uh, Addison's disease, and hypothyroidism. Type 3, also named as pseudo-acanthosis nigricans, is associated with obesity, and it is more common in patients with darker pigmentation and common in metabolic syndrome. Obesity also causes insulin resistance. Type 4 is termed as drug-induced acanthosis nigricans, and it is associated with intake of nicotinic acid in high dosage, estelbistrol in young male, glucocorticoid therapy, diethylestelbistrol, oral contraceptive, and growth hormone therapy. Type 5 that is associated with malignant diseases, it is the paraneoplastic lesion, and it is associated with adenocarcinoma of the GIT or genitourinary tract, and less commonly with bronchial carcinoma and lymphoma. Now, in type 1 of acanthosis nigricans, it occurs during childhood or puberty, while other types onset depends on the etiology. The onset of this disease is progressive. However, the malignant one and the type 5 or malignant one, there is a rapid onset of the acanthosis nigricans. The first change is darkening of the pigmentation, and the skin lesion appears as darkening of pigmentation, and it appears dirty, it thickens and appears velvety. The lines of the skin accentuates and surface become rough, and it seems that there are many protuberances are present on the surface That is why it is termed as mammillated skin. The lesion of type 3 is a velvety patch on inner upper thigh at site of chafing, often has many skin tag in body fold and neck. Type 5 or malignant one shows hyperkeratosis, hyperpigmentation more pronouncedly, and there is frequent involvement of oral mucosa and vermilion border of the lip. The hyperkeratosis of the palm sole with accentuation of papillary marking, that is termed as stripe hand, is also seen in neoplastic 1 or type 5 of the Acanthosis nigricans. This gross picture is showing velvety dark brown to grey thickening of the skin of 30-year-old female. There is prominence of skin fold and rugosity of the surface, neck, knuckle, and antecubital fossa in this patient were also affected. This gross picture is type 5 uh, Acanthosis nigricans. There is verrucous grey brown plaque in the groin, medial aspect of the thigh, and on the scrotum. Similar lesions were present on the neck and other body folds. This patient later found to be having a tumor of stomach, gastric adenocarcinoma. There is another picture, and in this gross picture, vermilion border of the lip is showing verrucous growth, and this is velvety. The oral mucosa was also involved, and there was a deep furrowing of the tongue also present. This gross picture is showing a tripe hand. This is the feature of type 5 of Acanthosis nigricans. There is palmar hyperkeratosis, and palmar ridges show maximal accentuation. This is another gross picture of Acanthosis nigricans. Here the skin is thickened. It appears velvety with skin line accentuation, and surface become rugose and mammillated. There are many protuberances are present on the skin. That is why it is termed as mammillated. So the lesion of Acanthosis nigricans are distributed most commonly in the axilla, then neck, back or sides, the groin, anogenitalia, antecubital fossae, knuckles, submammary region, and umbilicus. The type 5 of the Acanthosis nigricans or malignant one especially affects periocular, perioral, mammillary region and palms. The tripalm we have just seen. Now the histopathological appearance of all form of Acanthosis nigricans is same. The epidermis and underlying dermal papillae that are enlarged, they undulate sharply to form numerous repeating peaks and valleys, as is clearly seen in this photomicrograph. And there is a variable hyperplasia, and it is associated with hyperkeratosis. There is slight basal cell hyperpigmentation is there, but there is no melanocytic hyperplasia, and neither there is any dermal inflammation usually. To make a diagnosis of Acanthosis nigricans, there is essence of careful clinical examination for underlying endocrine disorders in overweight to morbidly obese persons, and especially if there is wasting of the muscle seen, should look for malignancy, and to find out the background cause of this disease, blood chemistry, biopsy, imaging, and endoscopy are helpful. The lesion is dark, thickened flexural skin and should be differentiated from other similar lesions such as Gorgegot-Cortrot syndrome, Tyriasis versicolor, X-linked thiosis, retention hyperkeratosis, and nicotinic acid ingestion. The course of Acanthosis nigricans depends on the underlying types. In type 1, the lesion is accentuated at puberty and at time it regresses when the patient become older. And type 2 the course depends on underlying disturbance that is there. Type 3 may regress after significant weight loss. This type 3 is associated with obesity. Then type 4, that is drug associated, resolves when causative drug is discontinued. And type 5, it actually precedes other symptom of malignancy for GI cancer about 5 years earlier than the malignancy. And after removal of the malignancy, there is a regression of the lesion of Acanthosis nigricans. The management of the cases is the symptomatic and treatment of underlying cause, and also the topical keratolytics and retinoids are both the topical and systemic are helpful. The dermatomyositis or polymyositis are also associated with the cancer, and the cancer patients have got about 5 to 7-fold increase to develop the conditions, and the association is more strong in the people who are above the age of 50. There is 70% chances that the patient gets dermatomyositis or polymyositis, and it occurs within a year of cancer. In men, the lung and gastrointestinal cancers are associated with dermatomyositis or polymyositis, while in female, breast cancers are associated with this condition. Switch syndrome is a combination of increased neutrophilic count, acute fever, and painful red plaque in the anus, neck, and face. And this condition is more common in the malignancies of hematopoietic system. This switch syndrome is discussed in a separate video.